pharmacy student called Gaia. I'm just here on behalf of my team when we're doing a campaign about COVID-19, and basically a little bit of brief about the campaign is that we're trying to promote awareness about COVID-19 and ways in how to prevent, the disease from spreading. Is it okay if I ask you a few questions as a pharmacist on your point of view?
Yeah, definitely.
Okay. Could you just tell me, could you start by introducing yourself?
Yeah,
please?
my name is Mohammed. I work for Day Lewis Pharmacy Group. I'm a community pharmacist. Actually been working throughout the whole COVID period. And yeah, far away.
Okay, so what is the role of a pharmacist in COVID-19 and promoting awareness?
Okay, I think community pharmacists had the biggest role. It's one of the biggest role in the COVID-19 to build awareness. I think when patient comes, because we are always the first port of call for patients around in the community. So when they actually, our doors are always open, so they can pop in and ask us many questions that they like. And of course, our knowledge needs to be up to date, and we will always answer whatever queries they have. I think a lot of people, I think when the first virus came out back in 2020, I think a lot of people were scared. They were unaware. Yes, the government did say everything. We had to reiterate what the government was saying. We couldn't be opinionated, because at the end of the day, we just have to give them the safety knowledge of how to protect themselves and, not to have to spread the virus. So I think we did have a big role to play in regards to building awareness during the COVID-19.
So in regards to you talking about awareness and promoting awareness to patients, what exactly did you guys do in your pharmacy in particular to promote awareness?
Okay, so is that including what restrictions we had, or just how we built awareness, like talking to patients? Certainly. So I think first, I think our main aim was to make sure not just myself, my colleagues who works here, we had the full knowledge of the virus, meaning that we need to know how it spreads. We need to know the symptoms. We need to know, if someone does get the virus, what we need to do. So this is the most important thing, that we actually educated everyone. So once we knew that, I think a lot of patients, as I said to you, we were always the first port of call. So they will either give us a phone call, or they might even pop in just to say, look, hey, someone's got a virus in our family. What do we do? So this is something that we will always approach firsthand and say, okay, this is what you need to do. This is what advice we will give. And we will always signpost them wherever department they need to go. And let's say, for example, someone in the family is really severe with the COVID, of course, this is something that will refer them to the hospital or their GP to get further advice. So we were always there giving that advice.
All right. So you also mentioned about preventative measures that you guys had in place. So what exactly were you guys doing? In addition to promoting awareness, what were you guys doing to protect yourselves in the pharmacy?
Okay. So I think back in, I must say, PPE wasn't a big thing, was it? It came out a lot later, didn't it? I think it came out in the summer. So I think when it first started, we had the stuff we implemented is a one-way system into our shop. Okay. We had restriction of how many people can enter the shop. I think we still kept that restriction now as well. I think we kept only 3 people can stay inside the shop. We also, I think, we did have cleaning every couple of hours. We always had cleaning in our shop. We implemented that. We had queuing system. We had, even back then, was hand sanitizer. I think, what's that? Hand sanitizer, was it?
With the public.
That's right. Yes, absolutely. Yeah. So we had hand sanitizers on our till, which we still do, and that was we always promoted that. Look, please use the hand sanitizer and go. We wasn't policing people. We just as a friendly gesture, please use your hand sanitizer if need to be, and go from there.
So from all the different types of measures that you guys had to take, the stresses that it caused as to you as a professional, how did that affect you mentally and your well-being with you and your colleagues?
I'll be frank with you, we were tired. We were actually very tired, and I think we were tired the fact that the workload did increase because
Yeah.
remember, people panicked.
Yeah,
People not stockpiling medication, but they were very anxious and they wanted their medication a lot earlier, and they wanted just to keep it at home because it would prevent them leaving the house, and just the thought of that fear. So yes, our workload did increase. However, this is something like during the COVID time, the compliance of taking medication was actually very good. People who did not actually take medication actually started to take medication. So that the virus, during the COVID-19 pandemic, it also built fear, stroke awareness to take the medication, be more compliant. So I think in that case, of course, our workload did increase, and I think physically, yes, we were tired, but we always thought that we had to do what we have to do. How to help us, colleague, each other. We helped each other a lot. We had like extra breaks. We managed. I think our NHS England has authorised us to actually close in the middle. So we had like normal. We opened from like 9 o'clock till 6:30. But they were kind enough to actually tell us in between you can close for 2 hours. So we actually utilised that just to get a mental break, also for cleaning as well. So it helped us a lot.
Okay, that's good to hear. Since you were talking about the things that you guys were doing in the pharmacy, like preventative measures and everything, how do you feel, or what are your thoughts on the current guidelines and the leniency that there is towards them at the moment?
Okay, that's a good question. To be honest, we do always compare with other countries, like Europe. And many of my patients who come in are from Eastern European, the area we live in. They always go on about their restriction in their country. So this always makes us think, are we too lenient in this country? So my personal opinion, yes, we should have kept social distancing. Okay, I think that should have been there all the time. Mask, yeah, definitely. I think that's the easiest, cheapest way to actually, to prevent this spread. So I think at the moment, I do believe some of these little restrictions that we had, actually not little, big restrictions we had, they should have continued.
So you agree on them being a bit more stricter than they currently are?
Yes. Oh, absolutely. Definitely. Because what it is, we know we are entering the winter season now. Of course, you can see it's very cold. Yeah. You also have the other virus, which is the flu virus, which is always there every year. So we're going to be like tackling the winter flu virus. We're also going to be tackling the COVID virus. So I think having these restrictions in place would have actually, helped us slightly eased it a bit more, alleviate some of the, crisis we're having now. So it would have been useful.
Thank you so much for your answers. Kind of opened me up into other sites that I wasn't really hearing or seeing. So since I introduced ourselves as a campaign, what would you like to see more from these type of campaigns?
I think who are you targeting? Do you mind me asking?
So right now we don't have a main target audience. Fine. So as we started off, we just want to target everyone. Do you get? Because this is affecting all age groups, absolutely, no matter young or old. Yeah. So we want to do the most instead of being the same as other campaigns on just tackling. Oh, make sure you do this so you stay safe. Yeah. There's other aspects like mental health. So. What would you think? Okay, so I actually do think campaigning about what you just said there regarding mental health. Also, I think best way is educating people with evidence. Unfortunately, yes, social media is very big, but I think using scientific evidence and educating people more about the virus would definitely help. And also, another thing is what you just mentioned there, which is really, really big. Mental well-being is very important to actually show that look, this is what's going on. This is how COVID affects people. Could you this is just to make people aware that look, this is also quite important to look into. All right. Thank you so much for your answers. Thank you for taking your time in helping me, and take care. Thank you.
Brilliant. Thank you very much.